Okay, the next tray we're going to talk about is the Prophy tray. Prophy is short for prophylaxis, which means a cleaning. So when you go in and get your teeth cleaned, you are getting a Prophy done. So we're going to go over these instruments. It's not something that you pass, but it is something that you need to know what each instrument is. So first one would be the mirror. That's on every tray setup. The second instrument is going to be an Explorer. Again, that's on every tray setup. Next instrument is called the periodontal probe, and you can see on there there's little markings. This is going to be used to check the depth of the gum tissue. So we're going to check for periodontal disease and make sure everything's normal. The next instruments are all called scalers. That's the only way I'm going to make you memorize it, is that they're scalers. So that's going to be what's used to remove the calculus and plaque off of the teeth. Some are for the anterior teeth, some are from the posterior teeth, but you should be able to tell the difference between scalers and the Explorer, because scalers are a lot thicker and they are sharp, so you have to be careful. Then we're going to move right on. Other things that you're going to find on the tray is going to be gauze. We need that to wipe off that plaque and calculus off the instruments. And if somebody had braces, we would use what's called a Prophy angle brush. It looks like bristles on the end. We would use that in either the deep grooves of an occlusal if they were stained, or around the brackets. The other one that we use is called Prophy angle cup. That is what's used. It makes it feel like you're getting your teeth brushed at the very end after they've cleaned your teeth. And then if you're a child under 16 or 18, we're going to use fluoride. Some people like to use these fluoride trays where they actually put the gel or that foam in it. The other thing, that other little small cup, is called Prophy paste. That's where they're usually good flavors. You can usually pick what flavor that you want. That goes with the Prophy cup and or Prophy angle brush. That's an ear water syringe. That's disposable. So that's where water's going to come out when you're rinsing their mouth. So either we use disposable. If it was all metal, don't throw those away. They're not disposable. You can actually sterilize those in the autoclave. There is a saliva ejector. We don't use the HVE when we're getting their teeth cleaned. We actually use a saliva ejector. That works like a straw. Obviously, we would use a toothbrush as well as a proxy brush if needed. Proxy brush, it looks like a Christmas tree. That's if somebody has a bridge or just big spaces between their teeth. You could give them that. And I think everybody knows what a toothbrush looks like. So when you do that with skills, this is all verbalized. Oh, and floss. Don't forget to floss.